The system that we work in is mental health and education. And the city of New York is a very unique system because historically there has not been a universal mental health bill or streamlined funding. And in fact, there are not a lot of funding available to support kids' mental health in New York City schools. We work to address this through direct access, through providing interventions and clinicians to schools that are most in need. We also work through policy and advocacy. We understand that there is a change needed. And in fact, over the last 3 years, we've been working on helping to solve the mental health crisis that exists in New York City schools. For example, over 3 years ago, we brought together legislators and stakeholders, including our kids and our parents, to come to the table and talk to one another about why is there a mental health crisis and how do we work together to solve it. What we have found is that we tend to work in silos and not in collaboration with one another. And so we began to build this system of support where entities and people across organizations in New York City could truly talk to each other and learn from one another to address the mental health crisis. That's one of the ways that we advocate. In fact, we're actually getting ready for our third annual Mental Health is All of Us Summit, where we'll bring our stakeholders again together to discuss this model, discuss research, as well as be able to walk away with tangibles. We also address what's going on in our system through destigmatization. Many of our families are dealing with a mistrust in the system, rightfully so, because many of them have dealt with being oppressed by the system. Many of them have dealt with mental health being weaponized. So a huge and also a challenging part of our role is to really acknowledge that distrust and that pain that families are facing, but also help to not just destigmatize, but what does it look like to reimagine mental health so that it's ethnic centered and so that it really reflects what our kids and families that are BIPOC needs, through ensuring that clinicians look like our kids and families, to ensuring that our interventions include Afrocentric and Latino-centric methodologies, and to ensure that they mirror the heartbeat of our communities. And these are the ways that we address these issues within our system.